Hello, listeners. A warm welcome to Waves on Health. On the program tonight is Dr. Sanjeewa Garusinghe, consultant neurosurgeon at the National Neuro Trauma Center of the National Hospital of Sri Lanka. A great pleasure to have you with us on the program tonight, Doctor, and a warm welcome to SLBC.
Thank you.
And for the information of our listeners, the focus on the program tonight is headaches and hidden causes. Without any further ado, over to you, Doctor, to introduce this topic.
Well, we are talking about the headaches, and headache is one of the universal symptoms. We all get headache. From childhood to adolescent, youngers, middle age, elderly. We all do get headaches at some point of our life. And if you talk about the causes for the headache, the diverse. There are a lot of causes for headache, starting from simple migraine to the other end of brain bleeding or brain tumors. So it's a spectrum of causes with one symptom, I would say. But there are ways of identifying and differentiating from which is responsible for your headache.
Having said that, Doctor, and yes, we all get headaches at some point in time, and not just once, but headaches do come on at periodically in our lives, and we take a painkiller, a paracetamol or an aspirin, whatever that suits us, and we carry on. But when you say headaches and hidden causes, that is something that we as lay people are not aware as to what these hidden causes are. Obviously, they are causes for concern, which is why you want to speak of these causes on the program today.
Correct. Well, when you talk about these causes, I would like to start with the different symptoms which could give rise to different causes. Because even though we talk about the headaches in broadly today, but there are certain types of headaches, the symptomatology is changing, and variant signs and symptoms which could direct us to, as a clinicians, as a specialist, to find out whether you have what kind of cause for your headache. So, for example, if you have a constant headache and you have a headache, especially worsening on early morning, and the headache is associated with nausea, your feeling of you sick and vomiting, and it doesn't respond to your conventional simple analgesic like paracetamol or whatever you take regularly, and keep on going and keep more day by day, there's intensity and severity. So these are the instances where we do brain scan and to identify the hidden causes such as brain tumors, sometimes brain bleeding, and sometimes we call the hydrocephalus, the increased water in the brain. There are lots of causes for only one symptom. So it's our part, based on your description, how you describe your symptoms, to identify to delineate or to differentiate which one is causing your symptoms.
Doctor, we have heard of like bleeding within the brain, the cranium. Now you spoke of water in the brain.
Yeah.
Bleeding is, I think, as a layperson, I might think, the head has obviously banged against some hard object, and that could be the cause for some internal injury.
Mm-hmm.
So water in the brain, how does that happen?
Well, Ms. Fatima, actually the why the thing I raised as a bleeding is not the trauma related bleeding. It's obvious. You bang your head, you get the brain bleeding. We are not talking about that in today. I think we are talking about the spontaneous bleeding happen in your brain. It bleeds without your knowledge. Especially, if you bang your head, you bleed. You know that this is the why I got the headache. But if you do get the headache without any reason, severe headache, maybe you collapsed, you fainting, and you get a vomiting, nausea, and you may have weakness. Your conscious level goes down. You're not talking, and it could be a sign of ruptured one of your blood vessel in your brain. We call ruptured aneurysm or intracerebral hematomas. These are life-threatening conditions. If you or your non-party got this kind of severe headache, it's very important to you to take the patient to a hospital to do a brain scan, urgent brain scan like CT scan of the brain to identify the causes. So this kind of headache common in people with hypertension and hypercholesterolemia, we call it cholesterol, and sometimes the diabetes and the smokers, and they get this kind of ruptured blood vessels in the brain. It can happen in young people like 40s, but do common in 50s, 60s, even 70s. That can happen. So it's one of the serious condition for headache, and it's a life-threatening condition. Need to identify soon and do interventions or treatment as soon as possible. And if you talk about this increased water in the brain, I mean that can happen in childhood as well as elderly people. So childhood, we call it hydrocephalus. Your maybe infants, maybe young child get increased water content because brain is always floating on water inside your skull. We call cranium because that's how it operating. You have the water environment throughout your life to make the nerve impulses working properly, and brain nutrition and brain waste products are circulated through this water. We call it CSF, or cerebral spinal fluid. So the water content can go up in different conditions. We call hydrocephalus, common in children, in one end of life. Similarly, it can happen in the other end of the life, like elderly people. We call it normal pressure hydrocephalus. So both of them can have neurological symptoms like headache, vomiting, fits, and sometimes their conscious level not good, and the memory can be impaired, especially the short-term memory in elderly, and sometimes they pass water without knowledge, they pass urine, and their walking is not good, like we call gait apraxia. They can't walk fast. So as I said, I mean, with the one symptom, when you inquire with the patient, when you take the history, when you talk to the patient, we get a lot of information from them, and with the examination, we look their eyes, talk to them, so you get more information, and then you do the investigation like CT scan or MRI scan. Then only we come to a diagnosis of what is the cause behind.
So, doctor, these are all absolutely frightening to when you sort of explain these conditions and how one can have these medical issues. So, obviously, we have to be alert. So, before we proceed, could you just once again tell our listeners, our audience, what they should do and what they should look out for when they get a headache, like frequency, the length of time you have it, and other sort of symptoms that you feel, maybe like you said, nausea, or you're feeling like drowsy, maybe you may be even having a fever. I really don't know. So if you just tell that before we move on to the next stage of this discussion.
Yeah. With the headache, if you talk about only the headache, if your headache is not responding to the simple analgesics, if you get worsening headaches over the period of time, for example, last month you were all right with headache, but now it's getting worse and worse, and you wake up with a headache, you get early morning headache when you wake up from bed, you get headache, and if your headache associated with nausea, the feeling of sick and vomiting, and sometimes you have the headache with abnormal movements of your body, we call fits or seizures, and sometimes changes of your behaviors, and memory impairment, problem with talking, and your intellectual behaviors. So then those are the things that we call alarming signs or red flag signs. Those are the significant or sinister symptoms we should alarm, or you should come to your doctor and get advice from doctor how to proceed with this.
Thank you, doctor. So having said that, what is the next step? Now your patient comes to you with these symptoms, and then obviously you go through the investigations, and you just speak, you diagnose, you think I need to do this, and you advise the patient these tests have got to be done. So from that point onwards, could you explain what the procedure is?
Well, I mean, when you come to us, the first thing we talk, as I think we discussed before, we talk to you and we discuss with you. We spend some time with you. We come to narrow down our list of possibilities. So we have, when you talk to you, the first we have huge list of chunk of differentials or the diagnosis. But more you talk, more you examine, and then we narrow down that, and we come. We say we ended up with 3 to 5 differentials or possibilities. So then that's the point we do investigations. So investigations are, I mean, as you all know, brain, you have to do a scan, and it could be a CT scan or it could be MRI scan of your brain. And there are special situations we do EEGs or electroencephalographies, especially if you have fits or seizures associated with your headache. But CT and MRI are the gold standard investigations. Say 99% of the problems we can identify with that. And based on that, so we go to next line of investigations, like the instance I told you about the brain bleeding. Then we do for brain angiograms. We call CT angiograms or DSA, digital subtract angiogram, as you do in the cardiac angiograms. Similar procedure we do in brains to identify the anatomy of the structure of the brain vessels. And that's how we proceed. And by those 3 or 4 investigations, we can diagnose what's wrong with you and what's your problem, what's the cause for your headache.
So then the procedure after that is surgery?
Well,
if necessary, or if you don't, you either try to treat medically first.
Yeah,
Is that
correct,
the way?
Correct. That's very true. I mean, the surgical conditions are not very common, but they do happen, and but we try to treat most of the time medical management or medical, you call it pills or medications. And sometimes we give a lot of advices for, especially the patient with migraine, one of the common condition. We ask them to avoid taking the caffeine, tannin, things like brown color foods, and drink plenty of water, and avoid any trigger factors like exposure to sunlight and whatever the noises or stressful situation. And then, but if you have, unfortunately, if your patient got a brain tumor or ruptured blood vessel, then obviously the treatment is operation. Then they should come to me, and we perform the operations. And one of the important thing I should mention here is, now the brain operations are not as bad as 10-20 years ago. They are very safe. They are, in Sri Lanka, we use all the modern technology available in the world. That happened in government hospitals, even in the private hospitals. The technology is much more advanced now, and most of the theaters equipped with high-tech stuff. So where we operate is shown up in screens. So the chances of missing or mistakes happening is very minimal. So they are very safe, and the hospital stays very short, and the recovery is very fast. And people should not have unnecessary fear of having brain operation, because one of the reason is if you do diagnose with something which need to be operated, and because of the fear, if you postpone that, and you may go for some other alternative medicine, but at the end, when you will come to us again with worsening of situation, maybe at that point we may not be able to do the correct treatment, because the condition is not as simple as at the beginning, like.
So it's always timely intervention is important.
Exactly. In neuro, in brain or spinal procedures, the timely intervention and the correct intervention is the utmost important thing.
And as you quite rightly said, doctor, if the patient delays, then it's difficult for everybody concerned, the patient and for the medical team.
Well, it's a challenge for us then. I mean, it's like, I mean, you won't be able to do the standard procedure if you have advanced tumor or advanced bleeding. The golden hours are very important.
So the advice you would give our listening audience is that they need to seek prompt medical attention if the condition continues for a period of time and that doesn't respond to basic painkiller basic medication, and if they're accompanied by the symptoms that you spoke of.
Correct. Yeah. Correct. I mean, yeah, that's very true. I mean, we shouldn't have any hesitation to meet your specialist or doctor and talk to them and find out what's going on with you. That's very important. And always you have a chance, you have time to discuss the treatment options, and then you start the appropriate treatment.
Going on to surgery, which is your specialty, and your focus is on the brain and the spine. Now we're talking about headaches, so just a question that just came to my mind when you talk of headaches and you spoke of the problems within the head. Will there be a situation where a headache can lead to a condition in the spine as well? If I'm just tell me, Sanu, I just wonder whether our listeners will also be concerned to know that.
Yeah, it's correct. I mean, especially when you have condition in the spine, you can have headache. For example, we call it cervical spondylosis or neck pain. So neck pain can go behind up to your back of your head. So sometimes the patient comes and tell, okay, I have a headache. Actually, when you look at them, examine and talk to them, it's actually the root cause is neck, not the head. But the neck pain can go up to back of your head. So you come as a headache, but ultimately the diagnosis is neck problem. That can happen.
So maybe that's something we can focus on another program. And just going on from there, doctor, now assuming that you're treating a patient surgically, and then and you did say, which is good to know, heartening to know, that Sri Lanka is as technologically advanced as the other countries, which augurs well for our health system.
Correct.
And having said that, so once surgery is done, would you say that the recovery is total? It depends, of course, on each patient and the condition, but by and large, you said that one need not fear surgery as one did 10 or 20 years ago, because new methods have come in, and we have doctors qualified to do all of this.
Yes. Yeah, I mean, the guarantee you can assure that how soon you are going to wake up and what percentage of your condition improved depend on your diagnosis or the condition. So most of the conditions, the treatment are very straightforward and results are very promising. And as I told you, the things getting worse if you have delayed presentation. For example, you come with delay presentation, you have symptoms for many years, many months, and you come with worse situation, whereas surgeons, trained doctors, we may not be able to achieve 100%. But if you depend on your presentation and your condition, the results are very promising nowadays. I mean, they're very, very good results.
Thank you, doctor. And just time is catching up with us slowly but steadily. Could you tell our listeners the procedure prior to surgery, the preparation?
Well, I mean, yeah, that there are two ways. I mean, we do emergency brain operations and we do routine brain operations. The emergency procedures, it's very fast track. That we talk to patient, we talk to relatives, and then we do a few basic investigations to make sure that you are fit for general anesthesia or make you sleep. And then you immediately taken to the theater. We talk about your allergies. That's one of the most important thing, because certain drugs and dyes we used in the procedure and may not good in allergic population, but still we can use that with special medical cover. So we need to know that your allergies and your past medical history. Those are the three things, and your last meal, like whether you had meals recently, because that's very important in anesthetic point of view. Then when it comes to the routine procedures, the preparation is slightly lengthy procedure that you need to be seen by an anesthetist and think about, because neuro operation, brain operations are lengthy procedure. It takes about sometimes 4, 5, 6 hours, sometimes 7, 8 hours. So you need to be seen by an anesthetist to see whether you are fit or you can withstand with long procedures. And we preserve blood for in case of blood transfusion. And we think about your skull opening, bone preservation, and sometimes placing implants to the brain, sometimes the titanium implants, sometimes we call shunts procedure. Those are foreign materials we implants in your brain and spine, and screws and plates and things. And that's those are the things. I mean, it depends on the situation and depend on the case.
And as you mentioned, foreign material that comes into the brain, obviously they are safe.
They are very safe. They are very safe
Because they are there for life thereafter, right?
They are there for lifetime. They're for lifetime. If you implant a brain, say for example, shunts, we call ventricular peritoneal shunts. They're lifetime. And sometimes we do implants on your brain like stimulators, and they're lifetime. And we fix the skull with screws and plates. Again, they're lifetime.
And post-surgery, what sort of procedures followed? The care, the treatment, medication?
Post-op
checkups.
Post-op procedures. Usually we do brain scan to make sure that we are successful or not, and if there's anything missing or any complications. And usually nowadays the procedures are fast track. Like you tend to mobilize the patient fast as possible and take them out of the ICUs and get to the ward and start mobilizing, walk up and about to start physio and sent to home as soon as possible. So usually after major brain operation, the convalescence or the recovery is about say 7 to 14 days, like 2 weeks.
That fast?
Yeah, that fast, and we remove the stitches after 14 days most of the time, scalp stitches.
And then the person gets back to a normal life?
Again, depend on the situation. I mean,
even on each person.
Each person, even the brain aneurysms, brain tumors, there are patients, they go back to work and they do their normal work, but they follow up in our clinics regularly.
And they're on medication?
Some of them we put them on anti-epileptic or some kind of medications, but most of the time the operation after say 2-3 weeks we can omit the medications.
So doctor, just one final question before we wind up this very interesting discussion on headaches and the hidden causes. You did say that that surgery is safe and it's done and you have had a success rate. And can there be any complications at any point in time?
Well, complications do happen. That can happen. I mean, the most important thing is the surgeon to identify the complications and start treating them, because almost all the complications there is a treatment option for the complication per se. So if you identify, if you understand the problem, then you start treatment. There won't be any issue to the patient. Say for example, your wound get infection, so you start antibiotic and you do wound toilet or wound debrimo again, and that's it. That's what you need. Like that, if you do the brain operation and if your patient is not recovering well, you do the scan, you find out a little amount of blood inside the brain, and you just open it again and remove the blood clot and close it up again. I mean, that's what we do. I mean, the complications can happen, but the secret behind is to identify the complication and start treatment timely.
Can there be any reaction after the patient is discharged? Now you've taken all the precautions, you've done the best you can, and the patient is discharged. Can anything happen thereafter? That's the question.
Yes, that can happen like fits. So we warn them with the possibility of having fits or seizures. So some of them are put on with anti-epileptic medications to prevent seizures for about at least 2 months, and that's only issue and wound infections.
Thank you, Doctor. And on that note, we end this interesting discussion on the headaches and hidden causes.
Thank you,
Dr. Sanjeewa Garusinghe, consultant neurosurgeon at the National Neuro Trauma Center at the National Hospital of Sri Lanka, we say a sincere thank you for sparing your valuable time to be with us on the program and sharing your expert knowledge on this topic. Thank you, Doctor.
Thank you very much, right.
Thank you too to Prabha Veerasurya for technical assistance. I'm Fatima Razikada saying good night and looking forward to your company next Monday same time on Views on Health.